One of the things I love to do as a physical therapist is answer real people's questions about real problems, and that's what I'm doing today. If you have your own question you'd like to submit, just email me at support@rickolderman.com and I'll do my best to get to it. Also, just to let you know, I have a new book coming out, Pain Patterns, Why You're Having Pain and How to Stop It. It's coming out in the fall of 2024. If you would like to be notified of when that comes out, feel free to mention that in the email and we'll put you on a list and let you know. All right, today's question comes from Tim. I have been fighting hip pain for 2 years and doing PT for most of the time. However, although I can do the exercises without a lot of pain, when I cool down, I am usually quite a bit sore than when I started. How can I make better progress? Well, Tim, I don't understand the exact nature of why you're having pain or the exercises your PT is having you do, but an easy way to figure out if it's one particular exercise that's causing your pain is to remove one of the exercises from your routine, do the others, and see if the soreness has changed. Likely you probably have some idea of whatever exercise that might be that's causing that pain. So just remove it from your routine and see if you have less pain as a result. And if, say, you have 50% less pain, then do that routine again and see if that's consistent. If it is, then look for one other exercise that you think is causing that pain and remove that one too. And if your pain is then resolved completely and you've removed those two exercises, then you know those two exercises are likely hitting on a problem that's causing the hip pain in the first place. All right? And that might be critical information for you to take to your physical therapist. So that's an easy way to break down your training program to find out whether there is one offensive exercise that is causing your pain and get to the root of why that exercise is causing your pain. It could be how you're doing it. It could be that there's an undiagnosed tear involved. It could be any number of problems that make those exercises more irritating to your problem than others. So now that we've gotten that out of the way, let's talk about what I think is causing most hip problems. And that is poor gluteal function, which is the butt muscle. And typically the butt muscle causes the hip joint to track and work correctly. Most exercises that address gluteal function are things like squats and lunges and things like that. But that involves multiple joints. And I believe that is too complicated for your body to correct function when it has to worry about multiple joints to correct in order to do an exercise correctly. So you've been wrestling with this for 2 years, Tim. I think it's time to isolate a muscle group rather than do multiple joint exercises. So the exercise that I have found most helpful to isolate the gluteal muscle is what I call the butt pump. It's one of the exercises featured in just about all of my home programs. And it's done like this, where you're on your elbows and knees, or if you can't get on the floor, then you're on a desk or table or countertop, and you lift that leg up and you pulse that leg up and down to make the butt turn on. So some people need to externally rotate the thigh bone a little bit because the gluteal muscle is also an external rotator of the thigh bone, and by externally rotating the lower leg, then you are automatically biasing the gluteal muscle to turn on. So that is a big one that seems to help a lot of people with hip pain or knee pain or sciatic pain or SI joint pain or back pain and so forth, because the hip and butt is central to the whole lower body function. It attaches to the hip bone and improves tracking of the hip in the socket, but it also improves rotation of the thigh bone in the socket too. For the hip joint does not like internal rotation of the lower leg. And the gluteal muscle is an external rotator. So if it's not working, then your leg is going through excessive internal rotation. Internal rotation equals compression. And especially if you're active and doing things like golf or other sports, what's happening is you're increasing compression and load while the thigh bone is internally rotating. Now, something that may be setting your butt up to fail is, what if you have a pronating foot on that same side? Pronating foot is a foot that's flat, all right? And so maybe the hip is excessively internally rotating because your foot is collapsing too. So in my programs, I have a taping technique that most specifically corrects foot flatness, which therefore corrects the tibial rotation. The tibia is half of the knee joint. The other half of the knee joint is the thigh bone. So if we can control excessive pronation of the foot and ankle, then we're controlling the knee and the hip at the same time. So it could be maybe your practitioners haven't looked further away enough from the hip to address other lower body functional problems that are occurring. Another thing that could be going on, Tim, is that you are compensating for a problem on the other side. I've made this video for you to test that potentiality too. So if say your left leg has problems and you're overloading the right leg, it could be that now the right leg is breaking down as a result of this. So that video will tell you will show you whether that's happening or not. So try that one out too. You may be addressing the entire wrong side of your lower body system. So, which is very common. I've found a lot of practitioners assume that if we're having a right-sided sciatica, right-sided hip, or knee issue, it must be a problem with the right side. And while that's partly true in that the right side is the thing that is experiencing pain, it could be responding to a larger problem on the opposite side of your body. If you think back to your old injuries playing sports or working or training habits and things like that, if you can think back and find maybe an old injury on your left side, like a bad sprained ankle, a knee surgery or something like that, after which all of this other right-sided stuff began, that might be a clue that you're compensating for a deeper problem on the left side. So hopefully that helps you too. I'm going to take a little break here and ask you to please subscribe, like, and then click that little notification button so you're notified when new videos drop on my YouTube channel. Thanks. So the butt pump exercise that I mentioned earlier can help turn on the gluteals to help correct the tracking of that hip bone in the socket. Now, if that hip bone is not working, if the hip bone is not traveling correctly in the hip socket, it will cause inner groin pain, it will cause outer hip bursitis pain, or it'll be diagnosed as iliotibial band syndrome pain. It'll be diagnosed as piriformis syndrome. It'll be diagnosed as arthritic pain. Because you can imagine, if the hip bone is not correctly tracking in the hip socket, all of those things are affected, all of those components of the hip joint. And so gluteal function is critical to that. The role of the gluteal muscle is to control the hip while we're walking or playing sports or things like that on our feet. That is when the gluteal muscle is most necessary. And so what is typically happening that's turning off the gluteal muscle while we're walking is that most people are wearing a shoe with a thick heel on it, like a tennis shoe, and they're walking where their foot comes out in front of them like this. Well, when the foot comes out in front and the body is left behind, the knee then locks and that turns off the gluteal muscle right off the bat. And so as we pass over the foot, the gluteal muscle is turned off and it's not controlling anything in the lower body or pelvic or low back system. So what needs to happen is that the body needs to come forward with the advancing foot in order for the butt to be activated at foot strike. What happens is when that's happening, the knee will automatically be softer, which is the key to turning on the glute when walking. So an easy way that I have people correct this is just simply doing some tiptoe walking. Put your hands on your butt cheeks and just walk around the room for 10 steps. Walk around on your tippy toes and you'll feel that your butt muscles are turning on with each step. Then after about 10 steps, keep your fingers there, but continue walking and you'll notice that the butt muscles are staying turned on. Well, the tiptoe walking is fixing the biomechanics of your walking pattern, and then that is carrying forward even after you start lowering your heels down from a more natural walk. You'll notice in those first few steps after tiptoe walking, it's likely that your body is now over your foot at foot strike, and that is what is turning on the glutes when you're walking. Hopefully that makes sense, Tim. Again, if you have questions you would like to submit, please email me at support@rickolderman.com and let me know if you'd like to be notified when my new book, Pain Patterns, comes out in the fall of 2024.